All right, I think we're going to get started, just looking at the time. I'd like to welcome everyone to the May 2022 session of the Erie County Workforce Collaborative Training Series. The Erie County Department of Mental Health is happy to be able to offer these trainings to the dedicated providers in our community to support workforce retention and provide an opportunity for individuals from our provider community to share their expertise. Today, we are excited to have Reverend Sue Frawley talk with us about LGBTQ plus concerns for youth and families. In June, we're happy to announce that the topic will be using existential therapy and enhanced meaning, purpose, and life as treatment for mental health and substance abuse disorders. I'm going to put the link for the registration for that June session in the chat at the end of this session. We'll also be sending out the announcement for that training later today or in the next day or two. And you can also go on to our erie.gov/mental health website for announcements and registration information. All of our training sessions are the fourth Tuesday of the month from noon until 1 p.m. So I'd encourage you to mark your calendars and watch for future notices on upcoming events. All of our presentations and recordings for our past training offerings are posted on our website. So I'd encourage you to check those out as well. At the end of this session, we'll be asking everyone to complete a very brief evaluation. We hope you'll take a moment to fill this out so we can continue to improve. At the end of this session, that link to that evaluation will be posted as well. This is a community collaborative, and we're always looking for volunteers to share their expertise with our community of providers. So if you're interested in doing a 1-hour presentation, or if you're interested in a particular topic, you can indicate that on your evaluation, or you can also email Amy Rockwood at amy.rockwood@erie.gov. This training is being recorded. Everyone is muted, so if you have questions, please put them in our chat box. Lynn Kazmarowski from Erie County Department of Mental Health will be monitoring the chat for us during our session today, so thank you to Lynn. And again, thank you all for joining us today, and I'd like to introduce Reverend Susan Frawley for her presentation on LGBTQ plus concerns for youth and families. Thank you so much, Sue. It's all yours.
Thank you so much, Kathleen. Good morning, everybody. I'm Sue Frawley, and I'm a board member of Niagara Pride, which is a 501c3 program in Niagara County that does advocacy and social connections for LGBTQ plus individuals and allies in Niagara County. If we could have the next slide, please. So my invitation to you today is to learn, whether it's increasing your knowledge about LGBTQ issues, or whether it's simply confirming some of the things that you've known, or perhaps within that, examining some of the self-attitude that you might carry about the LGBTQ plus community. I would love to encourage you today to work on personal change that hopefully can reduce harm and create safe access for LGBTQ plus clients and families that you will be encountering. For us to be together today, it's important that we be fair, be safe. What's said in confidence stays in confidence. Well, it's not really confident because I think we have like 100+ people here, but you know, what we say, we keep together. We focus on the content, not so much the person, but more importantly, what you learn here today, you take out into the world with you. And please do share this information with colleagues, somebody over lunch, your neighbors, your kids, wherever it is appropriate. Next slide, please. So to start us off, and especially since we're talking about youth, let's hear from youth themselves. Here is a video from youth talking about their experience.
A series of reports from PBS Student Reporting Labs. Today, they're exploring misconceptions of LGBTQ youth. It's part of their No Labels Attached series.
Time I felt misunderstood is when I told my dad I was gay. That's when I felt misunderstood. Like, okay. Because he didn't take it how I wanted him to take it.
I was scared to come out, and I just hid myself, and I fell into like a huge depression and couldn't trust anyone.
I had told someone that I was bisexual, and because of that, they thought that I liked everyone around me. I liked every boy and every girl, and they made fun of me for that.
I identify male, and my pronouns are he and him. People expect trans people to dress or express themselves very certain ways that are quite binding.
The biggest stereotype that you get surrounding being gender fluid or having pronouns that aren't necessarily set in stone is the stereotype of the special snowflake or the person who's just doing it to get attention or faking it specifically.
I used to get made fun of for being a lesbian, or people would assume I was lesbian. I'm bi, so the way I dress is typically judged. Like, a lot of people say I dress more masculine, I dress more like a boy, or I look like a boy.
In my day-to-day life, that's people being weirded out by me or being confused by me or misgendering me all the time. And it's not something that I should be dealing with or that any transgender person should be dealing with, because we want to just live our lives like everyone else.
It hurt because I was being bullied for it, but it was also, I tried to understand her because she didn't really understand me.
All my friends were compassionate. They didn't treat me differently like my old friend. And it was just finding the right group of friends to support you.
Being me is being myself, and that's whatever comes with me.
You are valid because you are. No matter who you are, no matter what you are, no matter what you identify as or what you feel, you are valid. Your feelings are valid, and that's the most important thing.
And there we go. I'm hearing it from our youth. Next slide, please.
For the last several weeks, we've been bringing you a series of reports.
So good we can hear it again now. So, today there's going to be a lot of terms. Some you may be familiar with, some you might not have heard before. And again, as we go through, please feel free to put any questions into the chat. One of our moderators will make sure that I know about those questions. And we may stop in between slides, but I also have time at the end where you again will be able to put any of the questions that you have, and I will definitely address to them. But I like the video from the young people, because with any kind of term, it's important to personify that which we are talking about. And you just met a variety of young people who are bi, who are gay, lesbian, pansexual, and we're going to talk about some of those. So LGBTQIA, and there's sometimes a whole lot of other stuff after that. What does it all mean? The rainbow letters. Well, of course, LGBTQ is lesbian, gay, bisexual, transgender, and queer. The plus parts of this come in when we also include questioning, which is a part for many individuals, and especially for transgender, of how do I move forward? Not questioning who they are, but how do I move forward to be my most authentic self? Asexual, ally, intersex, two-spirit, gender non-conforming, gender fluid, non-binary, pansexual, on and on and on. But let's go quickly. Lesbian is, if we work in the binary, women who love women. Gay is an arcing term, which had sometimes been used in the past to be any individual who loved someone of the same sex, and was primarily used to talk about men who love men. Bisexual is an individual, again by terminologies, who loves both male and female. And again, I'm talking on the binary, and sometimes it doesn't always fit there as well, but that is usually the term. Transgender, and I'm going to be going into this in greater detail, but a transgender person is a person who does not hold the gender that they were assigned at birth as their true gender identity. Queer is a term. For myself, I'm an older lesbian, and that term, when I heard that, boy, that would strike fear into my heart, because I knew something bad was going to come. But young people are taking this term back, and they're using it with empowerment. So queer can talk about a number of things. It can be an arcing term to talk about the multitude of ways that sexual identity and gender identity, and before I even go any further, just to say that those are two different things, gender identity, sexual identity. I'll get into that a little bit more. Queer also can be part of how a young person may talk about their romantic affiliations, and it can also just be a general attitude. So again, you may hear these terms. One of the things that I share with people is that when someone shares their truth and they're trusting you, it's okay to affirm that and say, thank you for being brave. Would you like to tell me more about what that means to you? This especially works with young people, because while young people are learning and expanding their vocabularies and understanding of gender identity, sexual identity, the way that they define some of the words they use may be a little different than how I'm going to share them with you. And of course, my base of knowledge comes from something called GLSEN, the Gay, Lesbian, Straight Educational Network, as well as the Human Rights Commission. But that's all academic. But it's important to ask a young person if they have shared with you, just what does that mean to you? And don't push back if the definition sounds a little different than what Sue told you today, because in the grander world, as a young person told me one time, it's identity, not you identity. So it's important to take people as they present and hold their truth as they tell you what it is. And of course, some of the ones I mentioned, but I really want to hold up with young people, especially, you will hear them identify as gender non-conforming. What the heck does that mean? Well, in a lot of ways, it means that they don't hold to some of the binary visions of male or female that they have seen in society, or gender fluid, that their presentation, attitude, or self-identity can be a sort of emotion aspect of how they see themselves. They may look one way one day and very different the next day, and it's all about how they hold in their attitude. Here's a biggie, because I have a middle school child and I have a high school child. Pansexual. I got to tell you, I hearing this, I think almost every kid in middle school is pansexual because they use this term constantly. And pansexual, what this means, if we compare it to bisexual and how that makes it different, bisexual being more on the binary, pansexual is being attracted to a person, not necessarily because of a gender identity, but because of characteristics of that person that someone finds attractive. And of course, for young people, they may define it in their own ways, but that is the way that it's usually used in academic. And it is different than bisexual, again, because of that binary component. As you can see, there are many different terms. We've collected almost 70 that we've heard from youth or others, and I'm sure there's more and more and more. Two-spirit is primarily used in the Native communities, and it has a lot more to do with some spiritual aspects of sexual identity and gender identity as well, but you will hear individuals using that. Here's the biggest thing, and I know this is something we're going to get some questions, at least I hope we do in the chat. Personal pronouns. Ay, parents pull their hair out over this. Last week they were she and her. This week they're they and them. Today they said they're sie and zierst. What the heck is all that stuff? Let's go to the next slide and I'll get a little more into this because I think it's the pronouns. Oh, no, it's more of the terms. That's okay. I am going to get more into the pronouns, but let's use this slide, which is going to get more specifically into some of the terminology. And trust me, I'm going to take care of those pronoun issues that you have because we all have them. But let's take a look at this slide.
You've probably heard of the abbreviation LGBTQIAAP2S or some form of that, but how many of the words behind these letters do you actually understand? Most people understand the first four, but things get a little tricky after that, so let's start with the basics. The term lesbian refers to a woman who is sexually attracted to other women, and the term gay refers to people who are attracted to members of the same sex, most often men who are attracted to other men. A bisexual person feels sexual attraction to both men and women. The term transgender describes a person who identifies mentally and emotionally as a gender that does not match their biological gender. It also functions as an umbrella term for trans people, including trans women, trans men, and transsexual, a term describing people who alter themselves physically through surgery or hormone therapy to align their physical bodies with their gender identity. Please keep in mind that gender and sexuality are not the same. A phrase to help remember this distinction is sexual orientation is who you go to bed with, and gender identity is who you go to bed as. That brings us to the first confusing letter, Q. This one letter actually stands for all of the letters together, queer. It's another umbrella term, and it applies to all LGBT plus people as a whole, and is a lot shorter and easier to say than LGBTQIAAP2S. Some people also use queer as a general term to identify themselves if they don't feel that they fit into a certain letter or group. The next Q also covers a large group, but this one stands for questioning. Just like it sounds, the term questioning describes people who are wondering whether or not they belong in the queer community or are still questioning their gender identity or sexual preference. I stands for intersex. Intersex people are born with or develop genitals with ambiguous sexual characteristics because of chromosomal or hormonal abnormalities. Doctors will often choose a gender for intersex babies and assign that gender through surgery soon after birth. It should also be noted that the outdated term hermaphrodite is considered offensive and should not be used to describe these types of people. The first A in this litany of letters stands for asexual, a person who feels only romantic attraction, not sexual attraction, towards any gender. This is not to be confused with agender, which describes people who identify as neither male nor female. The second A doesn't necessarily describe queer people at all. It stands for ally, a person who supports the causes of the LGBT+ community without identifying as queer or LGBT+ themselves. Ideally, this term would include everyone in the world who isn't LGBT+, but we're not quite there yet. P is for pansexual. Members of this sexuality are attracted to other people regardless of gender. This term is broader than bisexual, which limits attraction to just male and female. Pansexuality is also often related to an attraction to another person's personality. And finally, 2S stands for two-spirit. This Native American term applies to people who display both female and male qualities, whether in their personality, sexuality, or gender identity. And that's the queer alphabet. Even if you don't fit into any of these categories, I hope that you now have a better understanding of the people around you or even yourself and can work toward being a better ally for queer people throughout the world.
Okay, next slide, please.
You've probably heard of the abbreviation.
Okay, so with all of these terms, we have the gender unicorn. And I like the gender unicorn because it gives you a great visual in how many of these terms we've just talked about, and a few we're going to add in, come to be encompassed. Here's something to know. Every one of us watching this today is represented by the gender unicorn. Let's start with gender identity. And you see that the sort of rainbow is positioned in the thinking brain of the gender unicorn. The one thing I don't like about this is the sort of lines that go across, because again, a lot of this is not binary. It's not straight, pardon the pun. It's not something that goes right along any type of preconceived ending. It's almost like a menu where you could have a little bit of A, a little bit of B, but it's not really always leading to a similar result. So gender identity is how one thinks about oneself. You might think about yourself as female, you might think about yourself as male, and all the other genders, but it's something that you carry inside yourself. For many individuals, they've never thought about their gender, the gender that they were determined at birth to be. Many have espoused that, grown up within that, and never really questioned it. But for many others, thinking about gender, thinking about what that means to them, especially for transgender individuals, this is a very important area. Gender expression is different when we see the little green dots. For our little unicorn, the gender expression is another aspect of how someone puts out into the world how they want to be seen. My gender identity is female. My gender expression is more masculine. Some would say I'm a butch lesbian. Yeah, I am. But again, when we look at some of these lines, that would not necessarily always go straight along. Now, sex assigned at birth, and this was spoken about a little bit in the slide before, every one of us when we were born was assigned a sex or a gender. Years ago, if the gender or sex was indeterminable, and there are, believe it or not, 43 different categories that a doctor uses to make that determination if things are indeterminable. If we go back to before the 50s, even the 60s, if a baby was born and they couldn't figure it out, snip and a clip, here's your boy or here's your girl. And sometimes they never told parents about that, and sometimes they never told individuals about that. As science has moved along, now there is a holding by the American Medical Association to hold intersex as its own determination, and no need to do anything to alter that. And so what's great is in New York State, we just had the Gender Identity Act connected to our New York State human rights law, which now allows for an individual on their birth certificate to have X. Doesn't have to be M, doesn't have to be F. And it doesn't have to be because you're intersex. We'll get into that a little bit later as well. But it really helps for individuals who are intersex, who also are transgender and perhaps going through their own transitions. So yes, many different ways that gender can be represented. And here's something interesting. Before the government and insurance got involved, there was no gender on birth certificates. It was only when there was a need to categorize people and put people into lines that actually came forward. So just a little piece of trivia today. But let's get into physically attracted and also emotionally attracted. And this diagram that you're seeing is from the Transgender Student Organization. I don't remember which university. I hope that you can see on the bottom, it does talk about the citing. And they made a real distinction because there's a physical attraction unless one is asexual, and it can fall into lots of different categories. But there's also emotional attraction. Think about Jimmy Fallon and Justin Timberlake. I don't know the age of who I'm looking at. And there's other categories of this, of individuals who just have strong attachment to each other. It's emotional, but definitely not sexual or physical. And the fact that that was never held up oftentimes could be confusing for others of, I feel so strongly attracted to this person. Am I gay? Am I something else? No, you may just be emotionally attracted and attached. And it's normal and valid and all good. The vocabulary is ever expanded. And again, you see this represented on the unicorn with the 2 hearts. But every one of us is here in some capacity, in some way, in some constructed aspect of who you are in your gender unicorn. So we will move on. But again, if you have questions, please feel free to post them into the chat and I will speak to them. Next slide. So I did say I was going to talk about the transgender gender journey and transition with a little more specificity. Gender dysphoria is often the term that is used to make a clinical diagnosis that an individual is transgender. Now, this is not to say that every person who is transgender is a pathology of a sort, but in order to get certain surgical or other types of medical interventions, there needs to be some finding of gender dysphoria. What is gender dysphoria? It can manifest in a variety of ways, but it is usually an internalized rejection of the gender that was assigned at birth and all the attributes that come from it in being whole, healthy, and authentic. How do non-binary folks fit into this? Because this comes up a lot because we see more non-binary. Non-binary individuals do not have that same reaction as a transgender person may to being misgendered or being forced to fit into a gender role and expression that is not truly authentic. There are some transgender individuals who only do what's called social transitioning. And this is important also. Not every transgender journey looks like every other one. It's completely individual. So for many young people, and by young, I mean like 4 and 5-year-olds, because I've been dealing with those in this last year. Oh, wait a minute, Sue, 4 and 5-year-olds, how could that be possible? Well, here's another piece of information. In this last year, in February, the Mayo Clinic published a research finding that said gender identity is formed and aware from 18 months to 24 months. By age 3, young people very clearly know inside what their gender identity is. By age 5, they either conform to the gender identity that they have been told to be, or, as so many young people now are speaking up to parents or others and saying, well, I'm not a girl, I'm a boy, and then going forward with primarily social transitioning. What is social transitioning? It can be as simple as hairstyle, dress, name change, and then moving along in society. I got to tell you, for all the young people I've dealt with this year in Western New York, not a single one of them has had a problem with their schools. Parents have talked to the school prior. One of the best was first student, got to hold up the goodies. When parents had told them that the previously registered name now had a different, it was changed and clicked. And I had one little 5-year-old who was so thrilled when the bus aide called them by their authentic name when they came and picked them up for school. And all it takes is conversations. It takes a little pre-work, but it can be done. Where there's pushback, that's where other agencies and groups can come in to help educate, because that's really what it's about. It's easier when young people are younger. When a young person transitions in middle school or high school, because there's already been pre-established gender identity aspects with students, it's a little more, not awkward, that's not what I'm looking for. It takes a little more work, but I gotta tell you, the kids are awesome. And in fact, the middle school and the high school kids will be the first to defend a young person if, let's say, a substitute teacher is in and reads the register and it doesn't have the preferred name. They'll stand up or they'll speak, or if someone misgenders a young person. So I'm very happy to see this. Now, it isn't everywhere. I don't got the rose-colored glasses, but a large part of places do have this. And where it isn't happening, that's where we get to come forward and help to make that progress happen. As a young person gets older, especially when they get into prepubescence, pre-adolescence, hormone blockers and hormones can be very beneficial. It helps if a young person is going into that transition era, especially if they have really strong gender dysphoria. I mean, to be a female assigned at birth, but identifying as male, having your period every month can be such a trigger. But with the use of these medical interventions, it can help along that process. Now, again, that might be the end of it. Some may never do this. There is a local singer, born female, but identifies as male, and did not want to do this because they didn't want to change the quality of their voice. Again, every journey is individual. And then when someone is 18, because that is the line area, they might go forward with top or bottom surgery, as they say, sexual affirmation surgery. And again, believe it or not, we have some of the best surgeons here in Buffalo, and a lot of them are connected through Roswell. That would make sense because those are people who are doing many of those various kinds of surgeries. So we're very lucky in Buffalo that we have access to physicians and social workers and other resources that can help for this journey. It is not the same everywhere. And of course, if we're paying attention in the larger world around us, many of these things are being restricted in some states. More than anything, just remember that the trans experience is unique and it's going to be different for every person that you encounter. Next slide. More about the definition of transgender, and I won't belabor this more because I've already mentioned this definition. But it is important to know, GLAAD, which is the Gay and Lesbian Anti-Defamation Association, and also the National Center for Transgender Equity, shared some of these statistics that you see. They say that there are approximately 1.4 million transgender adults in the US, and there are more young people. We are still seeing that data coming forth. GLSEN, the Gay and Lesbian Straight Educational Network, just did a school climate survey, and those results have just come out. I did not put them into here, I apologize, but you can follow up that citing, where young people did identify, and there is a better data collection to give more to the numbers. But here are some of the other things that you may see. Some I've mentioned: may change given name from birth, may dress in different manner, may identify as straight or queer. Just because you're transgender doesn't naturally assume what your sexual affectation is going to be. Medical transition, as we talked about, gender identity through hormone, all or none. Each is individual. But as I said, and you see on the bottom, transgender youth who are in supportive environments are coming forward and sharing their true selves at younger and younger ages than people have experienced. There's some that say, oh, it's a phase or they can't know. I'll stand by the Mayo Clinic. They seem to be a very strong medical source and say, research shows this is true. And again, the sooner that a young person can be more authentic, we can avoid some of the pathologies that can come later in life. And we have seen with LGBTQ youth who have been repressed in being their authentic self. Next slide, please. Here it is. Pronouns, pronouns, pronouns. I promised you pronouns, and here we go. Pronouns are personal. They're not preferred. They are personally what a person chooses. Every one of you has pronouns. You might never have thought about it, or maybe you did. And maybe you're keenly aware that your pronouns are your personal choice. If you remember nothing else from today, remember the next sentence I'm about to say to you. Respecting pronouns saves lives. Respecting pronouns saves lives. And this comes from a national organization called the Trevor Project. And their prime focus is to reduce suicide amongst LGBTQ youth. And their research has also shown from statements from youth that when their pronouns are respected and used by adults, members of their families, and the community, it reduces the suicide ideations and or suicide attempts that those young people might be involved in. Now, how do we do this, the pronoun thing? Well, first of all, don't require pronoun sharing. You can actually out somebody or cause a trigger, and nobody means to do that. I know in our woke society, I go to a lot of meetings, especially our PTA. We've gotten very aware. Let's all go around and say our names and share our pronouns. Well, I like to say, let's share our names, and if you choose to, you may share your pronouns. And that way people can make that choice and do not have to go. But requiring it just could cause something that we just don't want to do. Start with yourself if you really want to know pronouns about another person. I always start with, hi, my name is Sue. My pronouns are she and her. Would you like to share your personal pronouns? And if the person does, after they share, affirm that to them. You can thank you for being brave and sharing. If they mention anything within, you could follow up and say, oh, that's an interesting pronouns. What do those mean to you? Or how would you like me to use those? Another follow-up can also be, especially since many of you are practitioners or working in areas, thank you for sharing with me. Do you want me to share your pronouns or call you by them in other areas? Really important question to ask, because a person might share with you, but they might not want other workers or other individuals or sometimes even their parents to know. You might be the first person they're trying these things out with, and that's okay. We'll get to that in a second. Eric Fine. Young people tend to change their pronouns as much as they change, I don't know, hairstyles, whatever. Just be aware of that. And this is the thing that makes parents and some of the support groups pull their hair out. You go with what they bring and you give yourself some grace. Oh my God, I said she and her, but I meant they and them. If that happens and you misgender someone, catch yourself, just say sorry, and then move forward and try to use the proper pronoun of the personal choice. That's all you got to do. You don't need to make a big deal. You don't need to put the focus on the individual. There's enough focus already. Just own yourself and move along. Most young people realize this. What they like is the fact that people make the effort, that they recognize that they've made a mistake, and they move along. And at all times, if you can, try to find statements or narratives that are gender neutral. A year ago, we were working with a camp and we taught them and said to say, okay, line up boys and girls. Well, that's pretty binary. So we're like, how about if you can have 3 lines? And how about if you use things that have nothing to do with gender at all? Those who like ice cream, those who like pizza, those who like something else. Try to make the choices. Recognize that things don't have to be sometimes the way that they have been set up. Schools go through this as well too, especially for physical education teachers. So we've been helping them to kind of change some of the names and some of the wording, which also makes things, again, more inclusive. So, one day just think about all the different ways you've talked with individuals, see where gender shows up, and see if you can change or alter that in some way to be more inclusive. Next slide. I know there's things coming up in chat, but I'm going to trust you. Is there a question or a statement that wanted to be made? Oh, I can't hear you. Sorry.
Lynn, I think you're muted.
Yep.
Sorry about that. A question just came in, but there's a few statements. Do you want me to read the statements or just the questions?
How about the question? Because I'm guessing people can read. I'm guessing people are writing statements to each other and being supportive. But I just would like to know what the question is, just to see if it's anything I could address for them.
Well, I have to read the statement, and then the question came after. It said, I have a transgender female client with mental illness whose caregiver refuses to acknowledge her. She calls her by her birth name and gender while voicing this is just a symptom of her illness and a delusion. We try hard to explain that she is actually creating a negative environment and mental trauma to her niece. What would you advise to better influence the aunt?
Yeah, that's a great question. Because again, in parental roles or guardianship roles, it can be very difficult. There are some that would say that purposely doing those things to a transgender child would fall into areas of abuse. Right now, it doesn't really fall that way within our legal terminology of New York. However, if there's a negative effect from that, a person tries to commit suicide or other, that's usually where the interventions come. But my advice would be to, if you're working with the aunt, as if I heard the question correctly, try to help them to understand, maybe share some of the information from GLSEN. GLSEN is also part of national education curriculums, and you can go on their website, glsen.org, and there's a variety of great resources. You can also find, if you go on NEA.org, the National Association, and you look up LGBTQ concerns and issues, you can find books, resources, other connections that can help to inform you. Some people don't like to talk about it. As some of you know, bibliotherapy works very well. You can give someone a book or a pamphlet to read and then maybe come back later. But it's hard. If people have strong roots and strong beliefs, they're not going to change, at least not right away. And if they're not listening to a child who they love so much, that makes it harder. So if we can't influence for the adult, the best thing we can do is try to find and create support networks for that child, be it a gender sexuality alliance program in their high school, some of the many different support groups that we have here in Western New York. GLSS, Growing LGBTQ Youth Support, has 2 different groups and drop-in centers, and the Pride Center also has support groups. And you can find those out at both of those groups' websites as well. And if we can't change the parent, let's do everything we can to love and support that child. That's the best advice. It's not a great answer, but it's the best that we have right now. Is there a follow-up to that or more in terms of what was asked for?
Nope, just said thank you.
Okay. Next slide, please. Pronoun song. This is going to be your earworm for tonight.
I'll pause it for you, Sue. There you go.
No, go ahead, Kathleen. It's good. I just love this song.
All right, here we go.
Kathleen, can you bring the volume up in yours? Because I think it's low for everybody.
And you want to get it right, but routine is set in stone. So you practice his pronoun loud and clear when you're alone. This is my friend, his name is Danny. He himself is a friend of mine. I'm so glad to be a friend of his. Both he and I are fine. So you have a friend named S, and the pronoun is they. And maybe you're not used to thinking of them in that way. And you want to get it right in the flesh and on the phone. So you practice their pronoun loud and clear when you're.
There's a comment that says that people are not hearing the audio particularly well. I don't know if you can raise it up somehow.
Self are a friend of mine. I'm so glad to be your friend. Okay, I are mine. Your friends or imply that they're pretenders, so be sure to use the pronouns that reflect their function. Habits make that hard, but there's not a dispensation to make some brand new habits. All you need is application. So you have a friend dog, and your pronoun is he. We should be a fresh to
So you're saying that it's really breaking up a lot. It's really hard to hear.
Okay. Tell you what, let's cut it for a second because I don't want to belabor people. So this, what you're seeing is this is called the Pronoun Song. It's by a group called the Double Clicks, and take time to go on YouTube. Just put the Pronoun Song or Double Clicks, and you'll be able to hear this. And what I like about it is that it just talks about practicing pronouns as someone shares them with you. Funny side story, I did this for a school district, and a principal, the wife is a friend of mine, and the husband was in the bathroom and she heard him singing this song and she's like, "What are you doing?" And he said, "Well, Sue did this thing today and I'm just trying to practice so tomorrow I can get the pronouns right." So there you go. Get the pronoun song in your ears, practice, and you'll do fine. Let's move to the next slide, please. So what do I say to an LGBTQ person? Welcome to Earth. No, just kidding. So, hi, it's as simple as that. Share your pronouns. Be careful of insisting. Also, using inclusive language, always. My default is I call every situation or person they and them. Since I don't know, this way I'm least likely to offend. People can always correct me. Interesting point, in the 1800s, that pronouns had no gender. Go back and read some old stuff, go into Shakespeare. It was they, them, and thou. So the use of these kinds of pronouns, even though people say, "Oh my God, I don't understand these young people," they're just bringing back old English. It's as simple as that. But they're doing it because they want to be inclusive and they want to be able to express themselves in a way that doesn't hold them into a more rigid gender term or idea. And you see again some of the different aspects. Also know that not every LGBTQ person uses pronouns, is out, or feels comfortable. Same for a lot of heterosexual individuals. Be easy, be gentle, and just go at a pace that works, and also offer your first. And then hopefully that invitation will bring forth some kind of conversation that helps you to understand a person more. Next slide. Here's a local statistic, and some of you know this because you work with some of these areas, but at any given time, the census for inpatient mental health in residential areas is between 40 and 80% LGBTQ identified. More than not, the statistic can be higher. This is important to know because if you deal with residential or let's say youth juvenile detention areas, you will be dealing with a lot of LGBTQ individuals. Now, kids who've been in the system sometimes also can be reticent to identify in this way. So again, be gentle, be careful, be an open and affirming person so you can deal with the whole person. Next step. And these are just a few. I'm not going to go through everything because I feel like I'm preaching to the choir in some ways, but health issues for LGBTQ youth are often disproportionately in ranges that, well, you see it right here. Aspects of attempting suicide, especially youth of color. And there's a whole lot of reasons for that. That would be a whole other seminar to get into, but please be aware that there are many, many different health issues that can come up for an LGBTQ youth that you may be dealing with. And being LGBTQ can be the block that prevents them from giving you information that helps you to connect with that greater part. So again, being aware of these things, the reluctances, oftentimes it can be insurance, fear of exposing, outed to family. The more sensitivity that you use, the greater you'll be able to give good service to them. Next slide. And here again, we see some statistics and you see the site sources on the bottom. And again, these will be available to you all too to go back and look if you want to. But again, like to the choir, the use of substance, the inclusion of substance in many LGBTQ youth's lives, as well as even adult LGBTQ individuals, is higher. And we know that we've got a problem in Erie County with fentanyl and other different drugs that are just causing amazing. Aware that you also may be dealing with a person who is LGBTQ, might not feel comfortable sharing that, but not that the LGBTQ is the pathology, but connected with other issues that may be blocks to getting the best service. So sensitivity and awareness. Next slide, please. When a youth or even an adult comes out to you, what are some things that are good to do? And here we're talking about being that ally, the A. Very important. Being an ally has power, and it has a lot of healing that you can do for others. So being supportive, but not assuming. Be a role model of acceptance. Appreciate courage and bravery. People will talk about safe spaces, but sometimes it's really more about brave, because no space can absolutely be 100% safe. Just, you don't have to respond. For many LGBTQ individuals, they have led lives of invisibility. So to be seen and heard by another individual is sometimes the greatest gift that you can give. Assure and respect confidentiality. You see some different questions in here, and these were some that we had talked about also with the pronouns. Who have you shared with? Do you have to keep secret? Do you feel safe? Do you need other help? Have I unknowingly offended you, and how can I do better? That can be a big one too. Always remember that the youth hasn't changed. They've just now opened up a view for you into their true self. In all ways you can, challenge the traditional norms. How can you do that? Well, take a look around your office today. What kind of pictures and posters do you have? Are they heteronormative? Are they inclusive? Do they show people of color? Do the magazines that you might have in your waiting area also reflect that? When someone comes to the receptionist, does the receptionist automatically say, hello, young man, young woman, or use a gender greeting? Or do they just use a non-gendered of hello and welcome? How may I help you? And acknowledge the name that's given. And of course, as an ally, sometimes you might be the individual, just as the question that came forward was, how do we give a referral? How do we give help? So the more that you can become knowledgeable about the resources in our community, I've mentioned two of those already, GLIS and the Pride Center. Those are great resources and supports for young people and for families. Next slide, please. The 4 ways of being a supportive ally. Be visible. Put things up. I have my Bill's Rainbow Gay Pride flag here in my little home office, but you can put other things. Rainbows are kind of the universal way that LGBTQ people look and know that this person may be a safe space. Supporting the people who come out to you, definitely responding to anti-LGBTQ language or behaviors, or even misgendering. Now, I am LGBTQ, but I also try to be a greater ally. And my kids hate when I do public service announcements in Walmart. I'm going through the line and a person will say, oh, sir, did you find everything you were looking for today? And I'll try to look around and see if maybe there is a more conspicuous male presenting. I'll be like, well, I don't know if he did, but I did. And then that catches them. And I'm not trying to trick or to be mean. And I'll just say, let's try it over. How about, did you find everything? And guess what? I did. And the person is either too stunned to respond, or we end up in a conversation and my kids are kind of hiding their heads going, I hope nobody from school is here watching what we're doing. But when you have that strength, when you have that privilege or that power, because I'm not afraid or offended, you can start to have that conversation. And allies definitely are able to do that. So where you can, do so. And I mentioned GSAs, which right now there are over 93 GSAs, gender sexuality alliances, in Western New York high schools and middle schools, and coming soon will be in some elementary schools. These are school-run programs by school faculty or staff. They connect with a local GLSEN subchapter and also connect to the National GLSEN program using approved curriculums and resources. And it allows young people to have conversations with teachers or staff that they see all the time, coming together with other students, and basically creating a community of support right where they're living every single day. So if you're in a community or you're able to do this, support GSAs. Next slide, please. Now, I mentioned safe space. Safe space gets talked about a lot. And the idea of that is that you put some kind of symbol or something that lets people know, without you saying it, you're going to be a welcoming and affirming place. Sometimes even making that outright statement. There is one family counseling place, that's exactly what's right on the door. We are a welcoming and affirming place. And then it talks about all the marginalized communities to which they are welcoming. Some places have safe space stickers. Some say brave space, but almost all use the universal symbol of the rainbow or rainbow colors. Next slide, please. These are just a couple of rights just to know about. Now, you may be surprised, again, Sue's trivia. There is no federal law that specifically protects the rights of LGBTQ people. Look it up. I never miscite law. But we are fortunate. In New York State, we have the New York State Human Rights Law, and it specifically covers LGBTQ people. The first that we had of this was GENDA, the Gender Expression Non-Discrimination Act. And you can read on there what it says. The problem with GENDA is it really didn't go enough, especially to talk about transgender individuals and sexual orientation, gender identity. So we got SANDA. And SANDA, again, expands that for rights, protections, and redress for aggressions. Then we have DASA, or DASA. I say DASA. Anyway, however you say it, it's Dignity for All Students Act. And it is specifically an educational act. But if you work in institutions that have educational settings, this would apply to you. It was formed to be a non-bullying act, but it very specifically talked about LGBTQ students, ways to address, obligations, and also reporting. And it just came this January, the Gender Recognition Act. And for those of you who work with New York State, you're going to see changes in forms. They said it would happen by May. It's already May, and I know you haven't seen these yet, but it will come, where instead of saying sex, male, female, or gender, male, female, it's either going to be a blank line or it's going to be MFX. Because in New York State, as I had mentioned, you can now put X on a birth certificate, on a driver's license, and other New York State forms. You will also see some other altered narratives and aspects for word in some of the forms. For instance, it might say, let's say you're dealing with something that has to do with an insurance base. Well, if a person hasn't gotten a writ order of a name change, it's going to use that first name. But then there's going to be a second line that will say preferred name. And it allows for you to put the legal name, as you have to for certain types of recording, but you can also put that other name so that the person can be seen as whole. And these are just some of the rights that we have in New York. Next slide, please. It's time for questions. What do you got? Please share and ask. I'll answer almost everything except my PIN number and my mother's maiden name.
Actually, we didn't get another question.
Okay, well, we'll let them sit for a second. Sometimes you have to percolate, you know. And I also know it's lunchtime, and of course people are like, "No, I want to get out of here. I want to get to lunch." So I understand. Here's the beauty. If you have questions after this, you can share them with Lynn or Kathleen or Amy, who's traveling somewhere in the air above us right now. They can get a hold of me, and I will give an answer back to them that they can share with you. Because sometimes it's hard to ask questions in the big group. I get it. I was a teacher. Nobody ever wanted to talk at conference days. But I see Kathleen did put in an evaluation. Kathleen, do you want to speak to that?
If we have no questions, and I just want to make sure nothing else has come in since we've been waiting. Great. I just want to obviously thank everybody for attending. Thank you, Sue, for your wonderful presentation. We appreciate your time. Thank you, Lynn, for monitoring our chat. I did paste the link, obviously, in the chat box. If you could take a moment to complete that evaluation for us, that way we can see how we're doing. Again, if you have topics you're interested in or people that might be interested in doing a presentation, feel free to put that in your evaluation as well. I also just posted a link for our June session. Our June session, again, is on using existential therapy. Mark your calendars for our future sessions. They're the fourth Tuesday of the month from noon until 1. We'll be sending out notices for future sessions, or you can obviously also go on our website. All of our presentations for our previous sessions will be posted, and Sue's presentation will be posted as well within the next day or two. Again, thanks, Sue, for your great presentation. And if no one has any other questions, have a good day, and we will see you next month.
Thanks,
Sue,
everybody.
thank you so much.
So we're closing out. Kathleen and Lynn, thank you so much for your help today. And I'm sure I'll be chatting with you. If anyone
Yes.
does give you any
Thank you.
questions, just submit them to me. I'll respond and you can share them back. That usually
Yeah.
happens sometimes after big things like this. So
Yeah.
don't be surprised.
Yeah, and Amy gets the survey results, so yeah, she'll reach out, like if there's a question in there, or, some type of, feedback, she'll definitely reach out once she takes a minute to look at those.
Awesome.
And we also talked about doing a part 2 to this
Yes.
series, so for parents. So I'm sure Amy will be reaching out to talk about that as well.
Yep. We have a whole, I mean, it gets into some of the similar, but it gets into real specifics for parents. So absolutely. Under New York Niagara Pride, we'd be happy to share that with you and give it to any of the parents who are involved in any of your programs or practitioners who want to know as well. So just like
And you even mentioned in your presentation, individuals, persons of color, and I think how specific that can be, that's got to be one that I'm sure would be helpful as well. So we'll be in touch.
yeah. And in fact, there is something called the MOCA Center, and it is connected through the Pride Center or Evergreen Health. They do fantastic presentations about LGBTQ issues for people of color. So if you go on to the Pride Centers, I'm not sure which, because I haven't looked at them, I just knew them directly. But please do contact them, because nothing means more than having a person who's in the community talk about their community. And I recommend them highly. I've seen the presentations and they're just wonderful. So that might be something as well.
Yeah.
Okay, thank you.
Awesome.
We'll definitely.
So that's is that a recorded presentation?
I do not know. I have seen it done. They might have recorded it. It was part of a community presentation more about their services. It was here and then it was defunct for a while, and now it's been brought back in, I think through Evergreen Health. So they're really just gearing up in terms of reaching out, connecting, having social meeting connections, very big with the Vogue and ballroom, if you don't know what all that is, but that's where we find a lot of youth of color connecting. So.
Okay, very good. Thank you. All right.
Have a great day. Thanks again.
All right, thank you so much.
Thank you.
This is great. Thank you.